woman's about to have her baby any minute. Someone get in here.
Hello. I'm Dr. Jake, and I'll be delivering your baby today.
Okay.
Let me get my gloves on, and we'll take a look at what's baking in the oven. All right, let's see what we have here. Uh-oh, just what I thought. It's going to be a big one. We better do an episiotomy.
Mommy, why? Birth is imminent and the perineum hasn't had time to stretch slowly. The baby's head is too large for the vaginal opening. The baby is in distress. The mother needs forceps or a vacuum-assisted delivery. The baby is in a breech presentation and there is a complication during delivery. The mother isn't able to control her pushing.
Is it going to hurt my baby?
Well, there are pros of having an episiotomy. The pushing phase is shortened, which reduces the chance of oxygen deprivation for the baby. It prevents perineal tears and permanent relaxation of the pelvic floor, and it maintains tightness of the vagina, which results in a continued pleasure after the woman heals.
And just so you are informed, we want to tell you about the cons of an episiotomy. Perineal tears are often smaller, repaired more easily, or not at all, and heal more quickly in comparison. An episiotomy is associated with more posterior perineal trauma, suturing and healing complications, and later pain with intercourse. So, if at all possible, an episiotomy should be avoided. Episiotomies also cause an interruption in skin integrity, which leads to an increased infection risk in 0.03% of cases. It's also possible that more tissue will become needed and may extend into the anus, causing increased bleeding and risk for infection. The two types of episiotomies, the midline episiotomy is associated with a higher incidence of 3rd and 4th degree lacerations. In contrast, the medial-lateral episiotomy repair is often more difficult, as well as an increase in bleeding risk than with the midline episiotomy, and it's also more painful in the postpartum, and pain usually lasts a little bit longer. Some other complications with episiotomies include infection, bruising, swelling, bleeding, extended healing times, painful scarring that might require a period of abstinence from sexual intercourse, and future problems with incontinence. All right, your baby is coming. We must proceed.
Yeah.
Oh yeah, she got me ready. Gotta be safe. Okay, here it comes. Have a big push.
The episiotomy follows this process. You will be positioned on a labor bed with your feet and legs supported for the birth. If you have not been given any labor or delivery anesthesia, a local anesthetic may be injected into the perineum skin and muscle to numb the tissues before the incision. If epidural anesthesia is used, you will have no feeling from your waist down, and no additional anesthesia will be needed for the episiotomy. During the second stage of labor, pushing stage, as the fetal head stretches the vaginal opening, the physician or midwife will use special scissors or scapula to make the episiotomy incision.
Here it comes. Oh. Yeah, sure. Happy birthday.
The baby baby will be delivered, the placenta will be delivered, the episiotomy incision will be examined for any further tearing. A local anesthetic will be injected into the perineum skin and muscle to numb the tissues. The perineum tissues and muscles will be repaired using sutures which will dissolve over time.
Congratulations.
Yeah.
Hi, I'm your postpartum nurse, and I'll tell you about some pain relief options we have.